Hi, Dr. Wynn. I'm Jenny Cavnar. I do TV for the Rockies, and I'm actually 7 months pregnant, so it's super cool to talk to an OBGYN from UCHealth Highlands Ranch Hospital today. First of all, how are you and your family doing? You have two little ones at home, your husband. Obviously, this is a crazy time during the pandemic for what you're doing at work and with pregnancy. Like, just paint a picture of what the last year has been like for you and how many things you've had to change in your life routine and your work routine.
It's been a crazy year. I think, March came and I could see in February that we were likely going to go into a shutdown just based on everything that was happening around the world. So we had mentally started preparing for that as a family. But when it really hit, the idea that we were all home most of the time it was tough. It was weird and it's been isolating. Fortunately, I'm back at work in person and my kids are in person learning most of the time. So they go 4 days a week. So we have a little bit more normalcy than a lot of families do.
I just want to start with the personal side of things for you. How is your mental health during that state? How is your work-life balance? It's very challenging for everyone.
The spring was awful. It was so stressful. There was a lot of unknowns and we were going into a disease we really didn't know much about. And I think there was a lot of fear among healthcare providers. Every day we would go in and you just didn't know if you were going to bring something home to your family, if you were going to bring something home that could hurt or kill somebody that you loved. And there's just a lot of anxiety.
Yeah, and a lot of anxiety for you at work, I'm sure. I mean, you're talking about being an OBGYN and having to deal with patients who are going through pregnancy during a pandemic, something that no one's ever done before. I'm sure it was lonely and isolating for a lot of those women. How did you feel your job changed? Because you probably really had to become much closer to the patient in order to get them through all of the unknowns.
Yeah, and that's been challenging as well because we are used to seeing the partners and having more of a relationship with them. And unfortunately, during this time, we don't see the partners very often. We only see them at maybe 2 or 3 visits throughout the whole pregnancy. And especially new moms aren't able to connect with people, with friends and family the same way they were pre-pandemic. So we're trying to provide a lot of support and give them just a lot of resources and kind of pick-me-ups to just help them know that they're not alone. It is a very isolating time to be pregnant.
Okay, give us your pep talk because you got the trial, you did it, you got the shot. Does it hurt? What are the side effects?
Yeah, the first shot, my arm was sore. So really similar to the Tdap and similar to the flu vaccine this year where my arm was a little bit sore for a day. We've seen different side effects for both vaccines. They're pretty similar. So injection site soreness, sometimes you'll get a fever. Some people have felt pretty crummy after the second, but not everybody.
I think something that everyone can relate to is you have a really close relative. Your grandmother is 95.
95.
It's probably been pretty challenging the last year to not get to see her as often as you did and make sure she was taken care of. What was that time like for her? And I heard she got the vaccine, so I'm very excited about that.
She did, yeah. So it's been crazy. I mean, 95, we know that she's at the end of her life. We just don't know when that's going to be. And it's so important for her to feel supported and be around friends and family. She's only seen a few people because we're trying to keep her so safe. So she was able to get the vaccine last Sunday at a UCHealth shorter AME event, which was amazing. I think it was great that UCHealth was able to go into the community where she was, and because she didn't feel comfortable going to a hospital, but she felt comfortable going to her church. So she'll be vaccinated, fully vaccinated in a couple of weeks, as will my mother and my stepfather and my aunt and my husband. And I'm so excited. It's like our own little vaccine bubble. So we're very excited to be able to gather again.
Well, Dr. Wynn, I appreciate your time. It was awesome to meet you. And thank you for giving me some hope as we're about to deliver a baby here in a couple of months.
You'll be great. You'll do fine. I'm glad you recovered from COVID.
Oh, yes. Thank you. Me as well. So great to meet you.
Great to meet you as well.